So in one of my previous videos, I broke down how to organize your performance or rehabilitation journey. Today, we're gonna look at the first phase, which is flexibility. We're gonna talk about how to know if you have enough flexibility, how to get more flexible so that you can get better at your training, or even help you get out of pain. My name is Shayan Safar. I'm a doctor of physical therapy, a board-certified orthopedic clinical specialist, and the owner of Unity Physical Therapy. I'm also a professional stuntman, breakdancer, and competitive martial artist. So when we're dealing with flexibility, the first thing we have to think about is what tasks do we need to do, and do we have enough flexibility for that task? In the previous video, I talked about the squat example. If you're trying to go all the way down in a squat without any compensations, we want to make sure that we have sufficient hip, knee, and ankle flexibility. We can break this down for any task. For an overhead press, we want to make sure we have good shoulder mobility. Luckily, there are some published normative values on how much flexibility you need for each movement at each joint. However, everyone's anatomy is different and the task might be very different. I have a background in breakdancing where some of those normative values, quite frankly, aren't enough for some of the extreme things that you're doing in breakdancing. The same goes for contortion, gymnast, and honestly, a lot of sports. Having a physical therapist break down how much flexibility you need for that task and what joint is a really helpful guide. Once we figure out where those flexibility blocks are, where are we lacking a little bit of flexibility, the question then that a good physical therapist or athlete should ask himself is, well, what's limiting that flexibility? We're always really quick to jump to muscles to being the source of problem, and quite frankly, oftentimes they are. If a muscle's stiff, it's gonna tug on you and not let you go that far. However, joints, and specifically the joint capsule, can oftentimes be the rate limiting factor. The problem is when people don't catch this, they keep stretching, but what they don't know is they're actually irritating themselves more, because if the joint capsule doesn't have enough room, when you're doing that stretch, you're compensating and you're actually causing impingement in these different joints. For instance, we'll go back to the squat example. You need a lot of ankle dorsiflexion to do a really clean squat. What happens is when people are trying to stretch, instead of feeling a pull in the calf, which is what you should for a muscle stretch, they feel a pinch in the front of their ankle. When that's the case, oftentimes the joint is lacking a little bit of posterior glide in the talus. The reason that's significant is if you just keep stretching through it, you might actually be making things worse. Like I said in my previous video, your body will always take the path of least resistance, which means if it's used to compensating by having the talus move forward instead of going backwards so you can stretch your calves, you're gonna just keep doing this and reinforcing that bad habit. So instead, this is where having someone to kind of push that talus backwards or adjusting how you do the stretch is really key. Now, I know it's hard to know and break down exactly every joint where you should feel it and what motion. Again, this is where having a trained clinician will be really beneficial, but it's something to think about. If you're trying to do your stretching and it doesn't feel like a good stretch, it feels like something's off, that can be a cue into the fact that the muscle isn't actually being stretched. You might have something else that's your rate limiting factor. Other things can be ligaments, and it can be nerves even sometimes, that you think you're stretching, but what happens is that nerve is having a little bit of entrapment somewhere, and instead of stretching muscle, you're just tugging on nerve. And that usually doesn't go well, because nerves don't like to be stretched on for long periods of time. They just like to be freed, and that's where hands-on therapy can go really well. Let's say we're working on flexibility, and let's say it is the muscle. Well, there is some research that shows that you want to hit about a minute of stretching a day, 5 days a week. Now, I'm kind of an all or nothing guy with habits, because I tend to, if I kind of give myself a day off, I'll falter, so I just try and go for every day. But what I really find is helpful is I do 2 rounds of 30 seconds of that muscle group with an intensity that's about 3 out of 10. There's some evidence that shows going above that intensity may not be beneficial. Instead, it might even be harmful for you to really stretch super hard. And notice, a minute a day isn't that crazy. So what I usually do is I do 2 sets of 30 seconds. However, I break up those sets with some exercises in between. And those exercises are doing eccentric exercises of that muscle group, which means the negative. So for instance, if you're doing a bench press, the positive is when you're pushing the bar, and the eccentric is as the bar is coming towards your chest. What happens there is the pec muscle is activated, but it's also being stretched at the same time. Eccentric exercises are really good for lengthening and strengthening muscles. So if I'm trying to stretch my quads out to get more flexible, I'll stretch them for 30 seconds. I'll then follow it up with some eccentric exercises of the quad, which you can see in this video. And then the last thing I'll do is actually strengthen the opposite muscle group, so that in that new range of motion I've created, We're getting opposite muscles to get stronger and used to that range of motion so that we can keep it when we're done with our session. A typical mobility session I put myself through is I will stretch that muscle, making sure I'm feeling it in the right spot. I will then do eccentric exercises of that muscle, and then I will do concentric exercises of the opposite group. If I have a therapist working on me, or if I'm working on somebody and they're lacking mobility, this is where we can really make some tremendous gains in that session, because with hands-on stuff, whether it's massage, joint mobilization, stretching, scraping, you can really kind of get into those deep layers of the muscle tissue and stabilize and make sure you're stretching properly. Then I'll have my patient or myself follow up with some strengthening exercises so they keep that range of motion. Just blind stretching without intention is not that great, and I think that's where a lot of people struggle, because they go, oh, I've been stretching, and it doesn't work, and they give up. And a couple things is they might not be stretching right. They might be stretching and then they just follow it with sitting down, which that's not gonna do that good. Or they just might not be that consistent because they've given up. It can take some time, especially if we're only doing a minute a day. We kind of show after that plateaus. However, again, getting some hands-on work can really help accentuate that. In some future videos, I'll cover each body region and movement and talk about how to get that flexibility and what you should look for. I just want to talk about some general ideas when you're doing your flexibility training. What are those things you should watch out for, how much you should do, and how to optimize it. It's always a good idea to warm up before you stretch, just because muscles, when they're warm, tend to be a little bit more pliable. That way, when you're doing your stretching session, you're not only safer, but you're probably getting a little bit more out of that session. As always, everyone's body anatomy and goals are different, so please make sure you go see a medical provider, or honestly, get evaluated by a physical therapist so that they can help you get results faster. If you guys like this video, please like, comment, subscribe for more future videos. Follow us at UnityPTLA on Instagram, or if you have more questions, go to unityphysicaltherapy.com. Thank you guys, have a great day.